Medicus Mundi International would like to take this opportunity to address Agenda Item 8.1. Our statement is supported by People's Health Movement. We appreciate the Commission's recommendations, immediate actions, and the 5-year implementation plan. The report importantly advances the link between health employment and health systems, but its proposals promote the perspective of an investment model rather than a social model where health and access to healthcare is viewed as a fundamental human right. There is strong evidence that the access to healthcare can be greatly enhanced by deployment of large numbers of community health workers with appropriate integration with the rest of the health system. Such a policy would also provide employment opportunities to poor women and stimulate economic growth. Expanding the fiscal space for country to invest in health workforce requires tax reforms to capture revenues from taxes that are systematically avoided and evaded. We urge member states to establish governance mechanisms and sustain funding through bilateral agreements which integrate cost-sharing, mechanisms for reimbursement of source countries, and through progressive taxation measures. This calls for review of the WHO Global Code of Practice on International Recruitment of Health Personnel and strengthening of public health systems in source countries. Health worker migration undermines the development of public health systems, especially in developing countries, while destination countries continue to benefit significantly. We urge member states to make use of the opportunity provided within the WHO Code, Article 9.5, to commence discussion on compensation and fiscal policies. We request the WHO and member states to invest in strong mechanisms to promote awareness, accountability, transparency, and sustainable financing to take forward the commitments made in the 5-year implementation plan for human resources for health at national, regional, and global levels. Thank you, Chair.